I do remember how we were all excited moving across from the Melbourne University campus to the brand new Doherty. We all felt like the sky was the limit here. Happy 10th birthday, Doherty Institute.
The Doherty Institute's an unincorporated joint venture between the University of Melbourne and the Royal Melbourne Hospital.
The vision is to improve health globally through discovery science and the prevention, treatment and cure of infectious diseases.
It was a new idea to bring together the available talent in this part of Melbourne, the sort of intellectual cutting edge, and the people who are actually dealing with real infectious diseases.
When I learned of the vision to put all of those elements in one building, I needed no convincing. I wanted to be part of it. The first 10 years of the Institute have shown what's possible.
We've had several breakthroughs to really understand the role of killer T cells in providing us protection from influenza viruses.
In the area of antimicrobial resistance, we've had a huge impact.
The Doherty Institute has actually been recognised as a global leader in pathogen genomics.
Solving the 80-year transmission mystery of Borrelia gave us a tool to control the infection.
The breadth of capability in influenza is truly incredible.
We established the Staphylococcus aureus network adaptive platform trial, clearly the largest ever clinical trial for this infection that's ever been conducted.
But without a doubt, the success I'm most proud of is our response to COVID.
The achievement of growing SARS-CoV-2, there was a lot of media attention being the first laboratory outside of China to grow the virus, to help other labs all around the world respond on all fronts.
Being involved in helping to set the national vaccine threshold targets for Australia. The beginning of COVID was pulled in to key national policy advisory committees, helping to think through how quantitative methods and models could be used to help address these emerging questions. Talking to people, they were very envious of my position of being here in the Doherty with everybody else in the house.
Over a matter of a couple of weeks, we were able to set up surveillance for all hospitalised cases of COVID-19, in addition to monitoring vaccination status and treatment data.
And we were world first to describe immune responses in a COVID patient.
The other thing that came through during the pandemic was helping the Pacific Island nations. We had a great outreach to them through various mechanisms.
The Institute came together in a way that I probably never could have imagined. The generosity of people, the hard work that people put in at that time, all of the expertise that we drew on from our staff, immensely proud. How have we been able to achieve success? It's because of the brilliant people that work here.
Since childhood, I dreamed of being a scientist, and now I lived my dream.
We've got over 200 graduate researchers here at the Doherty Institute. They come from all corners of the globe, which I think is a really good reflection on just how internationally renowned we are as an institute. I was taught all by scientists and researchers that are based here at the Doherty.
Teaching at the Doherty Institute is a privilege. Looking back on what we achieved, I think it's been very satisfying.
The Doherty really provides the supporting, nurturing environment that we can do the best science.
It takes more than the scientists. The administrative staff, people who wash glassware, people who clean the floors, those people take pressure off the scientists. No great institution works without great people. This institute is a frontline institute that will always need to be prepared and have the best available talent. So for the future of the Institute, it's enormously important we maintain that collegiality, because collegiality is what works great in science. We talk to each other, we interact with each other, we build on our strengths.
So what do I see in the next 10 years and beyond? Well, I think controlled human infection models are really powerful.
The coming Global Centre for Pandemic Therapeutics, what an incredible opportunity that is.
Receiving this grant with the coming Global Centre for Pandemic Therapeutics allows me to contribute directly to the advancement of novel therapeutics for respiratory diseases.
I'm very excited about the Australian Institute for Infectious Diseases. This institute will facilitate vaccine research not only in Australia but also in global health settings.
I'm also really excited to see some of these exciting new emerging technologies such as metagenomics.
We have a real opportunity to bring all of these elements together and go much more quickly from here's a problem in infectious diseases to here's a solution.
It's been a pleasure working here for this last 10 years. I certainly look forward working here for another 10 years.
I get up every morning looking forward to coming to work.
Happy birthday, Doherty Institute.